Diabetes is a disease that occurs when your blood glucose, also called blood sugar, is too high. Blood glucose is your main source of energy and comes from the food you eat. Insulin, a hormone made by the pancreas, helps glucose from food get into your cells to be used for energy. Sometimes your body doesn't make enough or any insulin or doesn't use insulin well. Glucose then stays in your blood and doesn't reach your cells. Over time, having too much glucose in your blood can cause health problems. Although diabetes has no cure, you can take steps to manage diabetes and stay healthy. Sometimes people call diabetes a touch of sugar or borderline diabetes. This term suggests that someone doesn't really have diabetes or has less serious case, but every case of diabetes is serious. What are the types of diabetes? The most common types of diabetes are the type 1, type 2, and the gestational diabetes. Less common types of diabetes includes monogenic diabetes, which is an inherited form of diabetes, and cystic fibrosis-related diabetes. What are the symptoms of diabetes? Symptoms of diabetes includes increased thirst and urination, increased hunger, fatigue, blurred vision, numbness or tingling in the feet or hands, sores that do not heal, unexplained weight loss. Symptoms of type 1 diabetes can start quickly in a matter of weeks. Symptoms of type 2 diabetes can often develop slowly over the course of several years and can be so mild that you might not even notice them. Many people with type 2 diabetes have no symptoms. Some people do not find out they have the disease until they have the diabetes-related health problems such as blurred vision or heart trouble. What tests are used to diagnose diabetes? Doctors use a variety of tests to diagnose diabetes and pre-diabetes. Your doctor may recommend different types of tests depending on whether you have symptoms or not, or whether you are pregnant. First, we have the fasting plasma glucose test. The fasting plasma glucose test measures your blood glucose level at a single point in time. For the most reliable results, your doctor will give you the test in the morning after you have fasted for at least 8 hours. Fasting means having nothing to eat and drink except sips of water. Second one is the HbA1c. The HbA1c test is a blood test that provides your average levels of blood glucose over the last 3 months. Other names for the HbA1c test are the hemoglobin A1c, glycated hemoglobin, and glycosylated hemoglobin test. You can eat and drink before this test. Before using the HbA1c test to diagnose diabetes, your doctor will consider factors such as whether you are in your second or third trimester of pregnancy or whether you have certain types of anemia. Third, we have the random plasma glucose test. Sometimes doctors use the random plasma glucose test to diagnose diabetes when you have symptoms of diabetes and they do not want to wait until you have fasted for 8 hours. You may have this test at any time. Fourth, we have the glucose challenge test. If you are pregnant, your doctor might test you for gestational diabetes with the glucose challenge test. Another one, we have the oral glucose tolerance test. The oral glucose tolerance test, or the OGTT, helps doctors detect type 2 diabetes, pre-diabetes, and gestational diabetes. How can a person may lower the chances of developing diabetes? Here are some things you can change to lower your risk. First, you have to lose weight and keep it off. You may be able to prevent or delay diabetes by losing 5 to 7% of your starting weight. For instance, if you weigh 200 pounds, your goal would be to lose about 10 to 14 pounds. Second, you have to move more. Get at least 30 minutes of physical activity 5 days a week. If you have not been active, talk with your healthcare professional about which activities are best. Start slowly to build up to your goal. Third, you have to eat healthy foods most of the time. Eat smaller portions to reduce the amount of calories you eat each day and help you lose weight. Choosing foods with less fat is another way to reduce calories. Drink water instead of sweetened beverages. Ask your healthcare professional about what other changes you can make to prevent or delay diabetes.